Hello everyone, I'm Dr. Ekta Bhushan, teaching Anatomy and Physiology of Exercise at Indira Gandhi Institute of Physical Education and Sports Sciences, University of Delhi. I welcome you all to the online lectures of CEC-UGC. In this series, we will discuss different topics associated with sports medicine. But today in particular, we will discuss the topic Introduction to Rehabilitation. So let's start with the definition of rehabilitation. Rehabilitation is the act of restoring something to its original state, like the rehabilitation of the forest that had once been cleared for use an amusement park. The noun rehabilitation comes from the Latin prefix re meaning again and habitare meaning make fit. So, rehabilitation is defined as a set of interventions designed to optimize functioning and reduce disability in individuals with health conditions in interactions with their environment. So, put simply, rehabilitation helps a child, adult or older person to be as independent as possible in everyday activities and enables participation in education, work, recreation and meaningful life roles such as taking care of family. It does so by addressing underlying conditions such as pain and improving the way an individual functions in everyday life, supporting them to overcome difficulties with thinking, seeing, hearing, communicating, eating, or moving around. Anybody may need rehabilitation at some point in their lives, following an injury, surgery, disease, or illness, or because their functioning has declined with age. So, some examples of rehabilitation include exercise to improve a person's speech, language, and communication after a brain injury, modifying an older person's home environment to improve their safety and independence at home and to reduce their risk of falls, exercise training and education on healthy living for a person with a heart disease, making, fitting and educating an individual to use a prosthesis after a leg amputation, positioning and supplanting technique to assist with skin healing, reduce swelling and to regain movement after burn surgery, prescribing medicine to reduce muscle stiffness for a child with cerebral palsy, then psychological support for a person with depression, training in the use of a white cane for a person with vision loss. So, rehabilitation is highly person-centered, meaning that the interventions and approach selected for each individual depends on their goals and preferences. Rehabilitation can be provided in many different settings, from inpatient or outpatient hospital settings to private clinics or community settings such as an individual's home. The rehabilitation workforce is made up of different health workers, including but not limited to physiotherapists, occupational therapists, speech and language therapists, and audiologists, orthostasis and prosthetists, clinical psychologists, physical medicine and rehabilitation doctors, and rehabilitation nurses. So, now we'll discuss the contribution of physical education teacher and coaches in the field of rehabilitation or injury management. So, as a coach, you are likely to be involved in each portion of the athletic healthcare relay, prevention, recognition, and first aid care, assessment and treatment, and rehabilitation. So, roles are defined by certain rules of the legal system and rules of your school administrations, expectations of parents, and interactions with other athletes, healthcare team members. Basically, the legal system supports the theory that a coach's primary role is to minimize the risk of injury to the athletes under the coach's supervision. This encompasses a variety of duties. So, duty number 1 is properly plan the activity. So, teach the skill of the sport in the correct progression. Consider each athlete's developmental level and current physical condition. Evaluate your athlete's physical capacity and skill level with presence fitness test and develop practice plans accordingly. Keep writing written records of fitness test results and practice plans. Don't deviate from your plans without good cause. The second one is provide proper instruction. Make sure that athletes are in proper condition to participate. Teach athletes the rules and the correct skills and strategies of the sport. For example, in football, teach athletes that tackling with the head is illegal and also a potentially dangerous technique. Provide proper instructions. Teach athletes the sport skills and conditioning exercises in a progression so that the athletes are adequately prepared to handle more difficult skills or exercises. Keep up to date on better and safer ways of performing the techniques used in the sport. Provide competent and responsible assistance. If you have coaching assistants, make sure that they are knowledgeable in the skills and strategies of the sport and act in a mature and responsible manner. The third one is warn of inherent risks. Provide parents and athletes with both oral and written statements of the inherent health risk of their particular sport. Also warn athletes about potentially harmful conditions such as playing conditions, dangerous or faulty equipment and the like. The next one is provide a safe physical environment. Monitor current environmental conditions, for example, wind chills, temperature, humidity, and severe weather warnings. Periodically inspect the playing areas, the locker rooms, the weight room, and the dugout for hazards. Remove all hazards. Prevent improper or unsupervised use of facilities. Next is provide adequate and proper equipment. Make sure athletes are using equipments that provides the maximum amount of protection against injury, inspect equipment regularly, teach athletes how to fit, use and inspect their equipments. Next one is match your athletes appropriately. So match the athletes according to size, physical maturity, skill level and experience. Do not pit physically immature or novice athlete against those who are in top condition and are highly skilled. The next one is evaluate athletes for injury or incapacity. Require all athletes to submit to pre-season physicals and screenings to detect potential health problems. Withhold an athlete from practice and competition if the athlete is unable to compete without pain or loss of function. For example, inability to walk, run, jump, throw and so on without restrictions. The next is supervise the activity closely. Do not allow athletes to practice difficult or potentially dangerous skills without proper supervision. Forbid horseplay such as wrestling around. Do not allow athletes to use sports facility without supervision. Next one is provide appropriate emergency assistance. Learn sports first aid and cardiopulmonary rescuation, that is CPR. Take a course through the American Red Cross, American Heart Association or a National Safety Council. Take action when needed. The law assumes that you as a coach are responsible for providing first aid care for any injury or illness suffered by an athlete under your supervision. So, if no medical personnel are present when an injury occurs, you are responsible for providing emergency care. So, use only the skills that you are qualified to administer and provide the specific standard of care that you are trained to provide through sports first aid, CPR and other sports medicine courses. If athlete is a minor, obtain a signed written consent form from their parents before the season. For injured athletes, specifically ask if they want help. If they are unresponsive, consent is usually implied. If they refuse help, you are not required to provide it. In fact, if you still attempt to give care, they can sue you for assault. Now we'll talk about some principles of physiotherapy and rehabilitation. So the first principle of rehabilitation, so there are 7 principles of rehabilitation. Principles are the foundation upon which rehabilitation is based. This mnemonic may help you remember the principles of rehabilitation, that is ATC is it. So avoid aggression, timing, compliance, individualization, specific sequencing, intensity and total patient. So let's start with avoid aggravation. So it is important not to aggravate the injury during the rehabilitation process. Therapeutic exercises, if administered incorrectly or without good judgment, has the potential to exaggerate the injury, that is make it worse. Then compliance. Without a compliant patient, the rehabilitation program will not be successful. To ensure compliance, it is important to inform the patient of the content of the program and the expected course of rehabilitation. Then individualization. Each person responds different to an injury and to subsequent rehabilitation program. It means everybody is different and everybody reacts to some kind of injury differently. Then specific sequencing. A therapeutic exercise program should follow a specific sequence of events. This specific sequence is determined by the body's physical healing responses. Then intensity. The intensity level of the therapeutic exercise program must challenge the patient and the injured area, but at the same time must not cause aggravation. Then total patient. You must consider the total patient in the rehabilitation process. It is important for the unaffected areas of the body to stay finely tuned. This means keeping the cardiovascular system at a pre-injury level and maintaining range of motion, strength, coordination and muscle endurance of the uninjured limbs and joints. The whole body must be the focus of the rehabilitation program, not just the injured area. Now, need and importance of the study of sports injuries in the field of physical education. So, the first one is it improved injury prevention. The professionals of sports medicine have in-depth knowledge of the entire body parts. They know how a movement impacts their body. They guide them on how to prevent probable injury. Even if one has suffered from any critical injuries in the past, it will remain unaffected with their unique set of exercises. The next one is innovative treatment options. Athletes are quite concerned about their bodies, especially when they get injured. They want quick treatment which ensures immediate recovery so that they can return to the pavilion. Sports medicine experts excel in providing innovative treatment options so that fitness enthusiasts may recover quickly. New treatments like stem cell therapy, PRP, that is platelet rich plasma therapy, ensures the restoration of the injured body parts. Now, personalized care. Professionals who specialize in sports medicine take wholesome care of fitness experts, athletes and fitness enthusiasts. They work in collaboration with the orthopedic surgeons and the physiotherapist to guide with particular exercises. They customize the treatment and diet plans as per the individual's body efficacy. The next one is improved performance. So, poor to the greater one. So, athletes and fitness freaks always want to enhance their performance and the body's potential. None other than sports medicine is the best way to gain height in their sports performance. The practitioners not only treat their fatal injuries but guide them with their exercises, diet and fitness training programs. They work to identify the improvement spots that may impact their performance. Now we have come to the conclusion. So, sports medicine is not only about treating and curing injuries, but it also deals with preventing them from adequate fitness programs. The professionals identifies the weak spots in the athlete's body and assess them in improving such areas. It not only enhances their performance but also reduces the risk of getting injured. Whether it is the immature or professional athletes, sports medicine experts guide them with their healthcare needs. They customize the fitness plans according to the age, gender, and type of sports an individual plays. As the type of injury is different in different games, the treatment procedures also differs. It is an advancing career options that one can pursue. So, I hope you understood the concept of sports medicine, its aim as sports medicine and rehabilitation, its aims, objective scopes and importance, and in the field of physical education and sports. That's all for today. See you next time. Thank you.